Hello and welcome. I'm Dr. Adam Dorsay, a psychologist in Silicon Valley and the host of SuperPsyched, a podcast dedicated to supercharging your life. Each episode contains fun, high-quality interviews with experts looking at psychology from all angles. SuperPsyched is your tool to get more of what you want in your life and less of what you don't. Okay, before I even get into this episode about porn addiction, let me say what I hope is a fairly obvious disclaimer. The content in this episode is for adult ears only. Please listen responsibly. Okay, that said, it turns out that online porn is big business. I did a quick search to find out just how big, and here were just a few of the not so obvious and even shocking stats I found from credible sources. Approximately 67% of American men and 41% of American women view online porn each year. Pornhub alone reported more than 2 billion visits in a single month in 2023. And lastly, more people visit porn sites each month than TikTok, OpenAI, Zoom, Netflix, or Amazon. So as you might imagine, there is a lot of talk and confusion surrounding internet porn use. Is there healthy use? When is it unhealthy? And is it potentially addictive? Thankfully, I know an expert to consult on these and other matters relating to this topic. My colleague, Dr. Paul Marcille, has some impressive stats that I have to share with you. He's got over 35 years of experience as a psychologist, professor, and he is the former vice president and dean of the American University of Paris. He's been the president of the California Psychological Association, and relevant to this episode, he has taught a continuing education course to mental health professionals on treating porn addiction alongside my colleague, Dr. Dustin Weissman. Also, and as you'll hear, he's highly personable and gives a great interview. So listen in as Paul talks about internet porn and porn addiction. Dr. Paul Marcille, who has asked me to call him Paul, welcome to SuperPsyched.
Well, thank you, Adam. Thanks for inviting me. I've been looking forward to doing this with you.
Likewise, this is such an important topic. Porn addiction, any addiction, but now that porn is so available, I remember as a young person, if you wanted access to porn, you'd awkwardly go into a store and buy it and say it was for someone else. And maybe if you were really, really into it, you'd go to a theater, which I imagine was very exposing. But these days, anybody who has a phone or internet connection, which is pretty much all of us, has access to more porn than we could have ever imagined. And it's not surprising that the incidence of online porn addiction are fairly high. My estimations based on my own research was about 10% of men and 3% of women. First off, let's define what is porn addiction.
That's a good question to start out with. But let me paraphrase.
Sure, of course.
The frequency of porn consumption. So as of last year, there were over 4 million websites offering pornographic content. And that accounts for roughly 12% of all sites on the internet. And because, almost all of us have 24-hour access to the internet through our phones, laptops, and other devices and stuff, and it's actually more accessible than ever. And porn, it's not just classic porn sites. Nowadays, you have through Instagram, through these Snapchat, through these OnlyFans sites, 24 hours a day, you can actually connect to someone who is promoting, talking about sex or whatnot. But we discount the number of people who read erotic literature, real fantasy, it's called, and even current films, things like 50 Shades of Grey, or a television series like Bridgerton portrays interracial intimacy and sex and whatnot. Those are all forms of, I wouldn't call them porn necessarily, but they're forms of erotic stimulation stuff that people are attracted to. And what I want to try and do too is normalize this. The great majority of individuals, 90% or more of people who look at porn sites, erotic sites, and whatnot, do not have addictions or problems.
Mm-hmm.
This is a form of fantasy and titillation. And there's the far right and Christian organizations, religious organizations oftentimes demonize people looking at pornography, even though some of the most repressive societies or even states in the United States, Utah, for example, that has got really strong bans on pornography, have some of the highest use or visits to porn sites of any state in the country. And many religious leaders struggle with the attraction to porn sites and whatnot. So one of the messages I try to give to the people I work with, that attraction to sexually topics, sites and whatnot is a perfectly normal, natural thing. And most people can look at these things, consume them, recognize them as a form of fantasy, just like watching a John Wick movie, for example. Watching a movie like that does not turn you into a hitman, okay, or a serial killer and stuff. People know it's fantasy. But there are a small percentage of people, as you mentioned, about 10% of men, 3% of women, who do develop an unhealthy, compulsive behavior around pornography. And that unhealthy behavior causes difficulties in their life. It causes emotional problems, physical problems, intimacy problems if they're in a relationship. It can pose very, very strong moral issues for people who think that it's wrong and yet still are attracted to these things. And that's what we mean when we use the expression porn addiction is almost a misnomer, because it's not an addiction like an addiction to alcohol or to a substance. It's more of a compulsive behavior. And in our profession, the profession of psychology and psychiatry, the DSM, the Diagnostic and Statistics Manual of the American Psychiatric Association, there is no condition called porn addiction. However, the ICD, the International Classification for Disease, does have a category concerning compulsive sexual activity, and porn use or unhealthy porn use falls under that, for the ICD.
And one of the best definitions I've ever heard for addiction came from Judson Brewer, who said it's persistent use despite adverse consequences.
Exactly.
And I'm wondering, you mentioned a few of the adverse consequences, and you've kind of alluded to healthy use, and we'll get into that in a sec. But what are some of, you mentioned there could be sexual repercussions of so-called porn addiction, which is ICD-9 or ICD-10 classified, and not necessarily DSM. But simultaneously, what are the consequences of porn addiction as you see it?
Sure. One, physical. So many of the young people that I work with who have an attraction to porn, unhealthy attraction to stuff, both watch it multiple times a day, but masturbate multiple times a day. Okay. And that can lead to some uncomfortable irritation, alia, in a relationship. If someone's in a relationship, an intimate relationship with a partner, whether it's a spouse or boyfriend, girlfriend, frequent use of porn and masturbation can decrease their sexual attraction to their partner.
Right.
Difficult to actually be intimate or interested in intimacy with their partner, leading sometimes to frustration on that partner's part. There can be disturbances in people's academic and professional activities because people who have this porn compulsion have a compulsion to watch it repeatedly, and it can disturb their ability to concentrate and focus. Young people trying to study and do assignments on their laptop or their computer, porn is just a click away while they're on their device. Professionals who work, most porn is actually consumed between the hours of 9 a.m. and 5 p.m., which means that people may actually be watching it at school or on the job. I've had former patients who've actually been disciplined or fired from their job because they either watched or downloaded pornography to their work computer. Now, despite warnings by employers never to do that kind of thing. Probably the biggest problem is that oftentimes people feel that watching pornography is immoral or bad or a sin. And it can create a condition called moral incongruity. And those are the individuals who are most likely to suffer from what we call porn addiction or porn compulsion, meaning that they have a strong obsession and desire to watch these things, but also feel bad because it's a violation of their cultural, ethical, religious, moral principles.
That's such a great word, incongruity, and it's consistent with what I was thinking about when you were describing it. When we aren't behaving in a way that is congruous, aligned with our ideals, we feel crappy. And it can also, in my estimation, lead to another psychological phenomenon in folks. I'm going to drop a big word, but reaction formation, when you go out and you preach against the thing that you actually do. So not only are we behaving in a way that is not congruous, but we preach out against the exact thing we're doing, almost as if to say, I'm beyond reproach, I would never do such a thing. Yeah, and that anybody else who does such a thing is bad.
Yeah, and it also may be a way of trying to reduce that moral incongruity,
and the stigma.
Despite the fact that in private, I look at these things and whatnot. In public, I denounce them, denounce people who do the same thing. And it might help someone to actually live with themselves. But the people who can't, people who are torn because they have this compulsive attraction to these things and yet find it morally reprehensible, that's where that incongruence and that lack of fit occurs. And that's what causes many people to be anxious, to be depressed, to suffer as a result of this. And what we do in psychology is either try to reduce or remove the incongruity by either changing the behavior. If you're a moralistic Christian person who doesn't believe that you should be watching these things, well, you need to stop and make the incongruence go away. Or the opposite, helping people to realize that perhaps it's okay to do these things in private as a form of fantasy, and that it's not a violation of their religious, moral, cultural, ethical principles. And if we can do that, then the incongruence and the emotional upset will go away as well.
I think that's really, really important. So let's talk about what is healthy use.
Well, I don't think there's any one definition of that. It's all a question of what you believe is okay. There are couples. So one of the statistics that's interesting is that solo porn use in a couple, in a marriage or a couple, actually increases the divorce rate significantly. So when one person in a couple, whether it's the husband or wife, or husband, wife, whatever the match is using porn excessively, and the other partner is either unaware of it or becomes aware and is not comfortable with it, that can be an enormous source of friction and tension in a relationship. And in many divorces nowadays, porn use is often cited as a variable that contributes to the dissatisfaction with the relationship. On the other hand, if couples are okay watching porn, whether it's two of them individually, one of them individually, but they're communicating about it and they're both okay with it, then it's something that might actually spice up their relationship and be okay. And it is possible to consume pornography as a form of fantasy, as a form of imagination, and yet still have normal sexual desire and interest in one's partner. And the reality is that anyone who watches porn, not everyone, but most people who watch porn know that this is fantasy, that the type of sexual activities and whatnot are not something that most people practice on any kind of regular basis. And while it might be stimulating and titillating, it doesn't necessarily mean that those people want to practice anal sex or an orgy or do other uncomfortable types of activities. And in real life relationships, sex is not just, and I don't know if I can say this, it's not just fucking. It's touching, it's laughing, it's talking while having sex. There are lots of aspects of intimacy that porn does not have.
And one of the things I love about Emily Nagoski's work is that every couple does it their way, and they don't compare. I mean, it's not that there's a so-called normal version, as long as it's not harming anybody, according to Emily Nagoski out of Smith College, who has become one of the state-of-the-art sexologists in the country. I am also really taken by the idea that it sounds like when we are ashamed by ourselves or ashamed by our partner, that can lead to that type of incongruity we talked about a moment ago, of not feeling congruous. And the other thing that really hits me is I've worked with many men who either have difficulty getting an erection or have a difficult time ejaculating because the stimulus of their partner is so different from the stimulus of the porn itself, causing sexual issues within the context of the couple. Is that consistent with yours
And I would even provide a simpler explanation than that. I've had men, and I work almost exclusively with male clients, Adam. 90% of my clients are adolescent males or adult males. And I've had guys come into my office complaining that they're not getting aroused or stimulated or being able to get an erection or have an orgasm with their partner. I'll ask them, how often do you watch porn and how often do you masturbate? And frequently, the response is every day or very frequently. And I'll suggest them as a very, very simple, sophisticated clinical intervention. Stop doing that. Don't watch any porn. Don't masturbate for a week. And then come back and see me and tell me whether you're getting aroused by your partner. And across the board, they'll come back and say, oh my God, that was a miracle and stuff. I'm suddenly able to get an erection, able to have sex with my partner and whatnot, simply because they're no longer exhausted, I guess you might call. And the other thing that I suggest to them is that fantasize about your partner. Don't just have fantasies that involve watching external stimuli, porn or literature or whatnot, but go ahead and fantasize about making love to your partner. Stimulate yourself and masturbate yourself to that. What people find sexually attractive is, for the most part, a conditioned response. Now, it's a conditioned response to things that we may have been exposed to at an early age. And we've come to associate certain types of individuals, certain body types, certain types of activity as erotic. And if an individual does not see their partner as a source of eroticism and whatnot, then yes, indeed, you're going to have trouble, both men and women, becoming sexually attracted and being able to engage in satisfying intimacy and sexual activity with your partner.
There's a biological directive to be sexual. And
exactly.
Yet we have these voices in our heads, kind of what Freud referred to as the superego, the authorities who tell us that it's bad or that there's a proper way of doing it. And I'm wondering, for the folks who you've worked with who give it up for a week and find that they are able to actually bounce back, what then? Do they go to a place of ceasing to use porn, period? Or do they find a way to titrate it up, using a medical term of like increasing the dosage up to a point where it's not causing adverse consequences to the relationship? What's next?
I mean, that would be my preference and stuff. I mean, I have a kind of a positive sexuality attitude about these things, that sexual attraction, sexual arousal is normal as part of the human condition, particularly when we're younger. And that to villainize that or to say that it's evil or perverted or leads to sexual aggression and violence towards women, that's not true. There's no evidence that that's the case. The conservative movement argues that pornography is sexually aggressive and violent, and that leads to dehumanizing women for the most part and can lead to sexual aggression. And there is some evidence for that. But that evidence is generally supports the idea that people who already have a tendency to become sexually aggressive and seek out sexually aggressive porn, those are the individuals likely to act out sexual aggression. That the great majority of people who witness sexual aggressive violence, just like watching murder mysteries and, as I said, John Wick movies, we do not become murderers or killers or whatnot. Or kids who play violent video games do not become school shooters. I believe that it is possible to have a healthy balance between a fantasy life, which could involve pornography, but also intimacy, real genuine intimacy stuff in a partnership or a real life sexual, relationship. And I would point out, Adam, that these moral ideas and values often come from childhood education and experiences. One of the things that I would hope all of your listeners become aware of is that children are being exposed to porn at an unbelievably young age. Any kid who has a tablet, an iPad, a smartphone, a laptop, and whatnot has access to pornography. And I hope no one's surprised to know that kids are looking for these things. We believe that the average child is exposed to pornography either inadvertently because they click on a link or because they've got a natural curiosity about sexual topics, somewhere between the ages of 9 and 13 on average.
Early exposure, I'm guessing that there are adverse consequences to that.
Yes, there are adverse consequences because children and teens, preteens are extremely influenceable. They're extremely susceptible to being influenced, their behavior being modified. I would even argue that young people are basically using pornography as a form of sex education because their parents are not talking about these things. The schools are doing that much less than they ever have before. And exposure to pornography at a young age does not create problems for most kids. They recognize that these things are fantasies, that these are actors and whatnot. It actually can educate them about what sex is, what bodies look like. And so it can be a form of sex education, but it can also be, as I said, it can also cause some young people to form an attraction to certain types of sexual activities, which are not, I don't want to say normal, which are not
maybe pro-social or pro-relational.
Pro-relational, yeah. There's a movement, a growing movement about positive sexuality, which strongly encourages parents or educators to begin talking to young people at an early age about what sex is, what's good, what's bad, to educate them about porn because they are going to see it, whether they stumble on it or whether they go looking at it for themselves, and to explain to them that these are the people in these films, and now we're just talking about pornographic films, are paid actors, okay? They're people who choose to do these activities. They oftentimes have, bodies that don't match 99% of our bodies because they exercise and they're chosen for certain characteristics. And that the things that they're doing are things that they're paid. They're following a script. They're being paid to do these things. And so there's actually a very, very good website called the P Conversation, Porn Conversation. And it was developed by a couple in Spain to try and help parents and educators talk to their children about pornography and about sex in a positive way. And the P Conversation website actually has curriculum for different age groups about how to address these topics. And I would highly encourage your listeners to check that out.
Well, I'm so glad that you brought up the P Conversation because it's as if we were absolutely in sync and having a mind meld. My next question was going to be, given that porn is an inevitability, the just say no approach from the 1980s from Nancy Reagan, if you remember that was not effective. Just say no, it doesn't work. It was nope to dope and ugh to drugs. I think that didn't really connect. But given the fact that children will do it, they will check it out. They are curious. Look in any Grimm's fairy tale. The parent says, don't do this, and the child does it. It's as old as the hills. That's how we grow. The question is, what do we do about it? So what are some of the best tips from the P Conversation or ideas that you would give to a parent whose child may be exposed at too young an age and may not understand what they're seeing and may be overwhelmed, may be misled, or somebody who's maybe overusing porn and having adverse consequences?
The basic advice is have a conversation about it, is to educate yourself.
What are the parameters of the conversation as you see it, though? What are some of the guidelines?
Well, I mean, one is to even just have the question stuff. Are you watching these things? So I just spoke at a conference last weekend about porn and porn addiction. And I recommended to all of my colleagues that they actually assess for this on a regular basis. And that means to ask their clients, but also parents ask their children, are you watching porn? I do that systematically with the young men that I work with. And Adam, the most common response is, oh no, I don't do that. And my response is, really? Would you like me to show you some links to some good sites for that? And they laugh. They laugh and say, oh yeah, okay, ha ha ha. Yeah, I do watch porn. The follow-up question is, how often do you masturbate to it? And they then respond, oh, I don't do that. And I say, really? Do I need to explain to you how to masturbate? And then they laugh again, and that breaks the ice. And then you can have that conversation. But if you're uncomfortable as a clinician, an educator, or a parent having that basic conversation, then there's never going to be communication about these things. And I will actually ask the parents of the teens that I work with if I can have permission to talk with their kids about these subjects. And I would say 90% of parents are delighted that I'm going to do that because they're not comfortable doing it themselves.
Zach Gottlieb, who was on my podcast, he's an amazing young man. He's now a sophomore at Stanford, but I remember having him on my show when he was a sophomore in high school. He created a site whose slogan was, "We can't fix what we don't talk about."
Mm-hmm.
And I hear you saying exactly that. The first step is to talk about it, and you will face resistance. They will deny because they'll be embarrassed, but need to find a way to break the ice and talk about this thing without being overly intrusive. It sounds like finding that equilibrium of inviting the person to talk about it is the first step.
Talking about it, being honest and whatnot. I mean, I think most of us, we're growing up, we don't want to think of our parents as sexual individuals.
Oh, right. No, it says everyone throughout history, no one wants to imagine. We're happy to be here, but we don't want to imagine how we got here.
That's right, exactly, and stuff. And that's just repressive. Now, there are plenty of cultures around the world where people do talk about sex. But up until recently, people did not have separate bedrooms. I mean, families all slept in the same room. In many cultures, they slept in the same bed. So they were aware of parents, older people having sex and whatnot, maybe even witnessed it themselves. There are some cultures where young people are actually introduced to sexual activities by an older person to try to dispel any misunderstandings about how these things operate and work. We don't do that in the United States. But having that conversation, because kids are going to do this, it's important to realize that the minute that children hit puberty, which can be at 10, 11, 12, 13, 14 years old and stuff, they are sexually primed. And up until recently, children at that age would marry, would have children. It's only recently that we've created this concept of a period of adolescence, which is a period between childhood and adulthood. And this idea that it's only when you're turn 18 or you're an adult and stuff that you're allowed to be sexual and have sexual activity. It's ridiculous. There's an arbitrary kind of date. So realizing that when a boy or a girl hits puberty, or maybe before, they have a natural attraction to sexual activities. I mean, that's the biological imperative that human beings have to mate and reproduce. And that there's all of this stimulating sexual content out there in advertising, in television, in film, in literature, even fairy tales, which you mentioned earlier and stuff. There are implied erotic relationships. So having educated conversations about it, answering young people's questions about these things. I'm not going to encourage, parents to sit down there with kids and watch porn together.
Oh my God. Just watching a romantic scene with one's parents can be just
is uncomfortable.
Even clothed. It's like,
right. But again, that's another form of incongruency because everybody's watching these things. Huh?
Right.
And yet we don't talk about it. So just some frank conversations. I think demystifying these kind of things. The young people I see who have problematic use of pornography or whatnot, are the ones who aren't talking about it. It's this dark, dirty secret and whatnot. It makes them feel bad about themselves, feel guilty, yet they've got a compulsion to do it. And they're the ones who suffer the most, as far as I'm concerned.
Yep. And one of my all-time favorite quotes attributable to many thinkers is, "A problem well defined is a problem half solved." Mm-hmm. And you're speaking to this idea that we need to talk. I'm wondering about adults. Let's say you've got an adult who is addicted to porn. What are your top tips for them?
One, to recognize, to be objective about the positive aspects, things that can help, but also the negative. So if someone's obsessed with pornography, with masturbating, whatnot, and it interferes with their ability to concentrate while they're at school, to go to their job and focus and concentrate because they have this urge to watch these things. What we do is, number one, demystify them, their natural urges. Number two, to have people realize that they can have these thoughts and these fantasies and these images, but they'll pass. At the conference on Sunday, I talked about a technique that we use in therapy called acceptance and commitment therapy, meaning that you accept that we have thoughts, we have ideas, but those thoughts don't necessarily have to lead to acting on them and behaving on them. There's a concept called urge surfing that I use, where I try to teach people that when you have a thought or an idea or image that comes in, you can experience it. You can think about it without causing you to act on that thought or that impulse. And usually within 10, 15 minutes, that thought will go away. You can focus on other things. The pandemic, which caused all of us, young and old, to live at home and live online, spend enormous amounts of time on our computers and stuff, greatly exaggerated the tendency to watch porn and sexually satisfy ourselves alone. And the young people I see who grown up in critical periods of development during the COVID-19 pandemic didn't necessarily develop normal socialization skills, the tendency to look outside for social contact, for emotional connections, and also sexual connections as well. And so encouraging people to do alternate activities besides watching porn by yourself is to get out, meet people, socialize, and experience all the excitement that real life relationships and intimate relationships can bring about, which porn cannot do.
Very interesting. So, given the fact that we have a sexual directive, you're suggesting that the drop-down menu contain more items than just go do the thing that you've always done and get the results you've always gotten. Maybe have more items on the menu and do those as well. Diversify your portfolio.
So, Adam, Pornhub, which is probably one of the most visited pornographic sites in the world, publishes an annual report about the number of visits to its site and what types of things people are watching, which is kind of interesting to know what people are interested in. But the average time to visits on sites, it's less than 5 minutes after people are on it, which would indicate to me that people are looking at these things, they're masturbating to them very quickly and then disengaging. And real life sex and intimacy involves a whole lot more work. It involves engaging with a potential partner, dating them perhaps, doing a variety of things. And the sexual act is usually not something that simply takes 5 minutes and then it's done and over with. And so that involves a lot of effort. It's much more complicated. And if someone has strong sexual urges but has no clue how to engage with real partners, how to have real sex with someone, then porn can become a simple, cheap, efficient substitute, but nowhere near as gratifying and satisfying as real relationships.
Yeah, it requires so much talking and so much coordination and, of course, consent being the biggest driver.
Right.
And I remember talking with Shafia Zaloom. She wrote a book called Sex, Teens, and Everything in Between. I think that's what it was called. And I thought that was a really important book. Her big takeaway was that consent is sexy. And you don't see that in porn. The paid actors do what they do, but there's not much talk about what they're about to do and asking, do you like it? And consent and all of those other things. What are some other things that people need to know in order to have just a baseline for a relational sexual relationship between themselves and another person that might be lost due to what I'm going to put quotes around the word education, the way we're being educated by porn?
Well, I don't know. We don't accompany as a psychologist, I don't accompany my patients, into their homes.
I'm not suggesting you do, but there might be some very important lessons that are lost if a person's exposure to sex is solely around porn. Maybe I'll rephrase the question, lest you think that you should follow them home. But I'm talking about the idea that there are some very important interpersonal aspects to sexual coordination, communication, consent, and other things that could be lost when two actors who are paid to be getting it on Pornhub do what they do.
Well, definitely. I mean, I think those of us who are in relationships or have had intimate relationships, as you indicated, talking about your relationship, talking about intimacy, talking about what's attractive even touching, holding hands, kissing someone, nuzzling someone, hugging someone. Those are all aspects of intimacy that we really don't see, in pornography. The smell of your partner, the taste of your partner, the kind of things that each one of us finds exciting and titillating and enjoyable. Those are all aspects of intimacy that pornography and fantasy is not necessarily going to provide you. And then there's after sex, just closeness, holding one another, being with somebody that you care about. It's the interludes between sexual relations, a private joke, a glance with your partner across the room, a smile. All of those things, from my perspective, are a form of intimacy and somewhat erotic kind of acts. And porn doesn't do any of those kind of things at all, and can leave someone, feeling really empty, despite getting excited and perhaps having an orgasm and whatnot. It's real life in porn. And I think that's what we need to convey to young people. It's just a very, very basic, I don't want to say empty, but it lacks all these things that I was just talking about.
It's interesting. Just to go back to some content, I know that when you use the word religious or Christian, it would be really any religion, any dogma that may be shaming. And then I want to kind of get into the idea that there might be some good places to go for perhaps some better ideas about sexual technique, about connecting with your partner, perhaps things that are directed by females or going to certain websites. I'm forgetting what they are, like Adam and Eve or something like that, where they actually show couples who are paid, real life couples who show how they do what they do and provide a model for some ideas. What are your thoughts on that?
So there's a positive sexuality movement out there, which does promote consensual sex by real people, talking about real people. That P Conversation website has links to it. One of the founders actually produces consensual porn, showing real people doing real things. And so I'm not an expert on everything that's available out there. I wish I could provide you with some other suggestions, but it does exist. And the United States tends to be an extremely moralistic society, just as we see in our political landscape. You have extremes to either side of things. And sex is just such a hot button topic that I think attracts to extremists.
Definitely. And Paul, we're getting to the end of our talk, but is there anything I should have asked but haven't yet asked?
No, I don't think so. My goal was to just kind of normalize this more and have an open adult-like conversation about it. And I hope anybody who listens, whether they're parents or educators or therapists and stuff, educates himself a little bit more about these things and becomes more comfortable talking about it.
Definitely. I remember in graduate school, and as I was telling you in the green room, I had a sex therapy professor who said, if you can't talk about sex with your clients, maybe you should consider another profession, because being able to talk about this aspect of our lives.
Yeah, because it's such an important one. And I think anybody who can't do that, I question whether somebody should be a therapist.
Right. Yeah. So let me ask you this final question. I always ask as a miracle question, Paul. If you had the power to confer upon all humanity one insight or skill that would dramatically improve the lives of the individual, and since we're all connected, perhaps the people around that individual, what would that insight or skill be? And how do you imagine it would impact the individual as well as perhaps society at large?
I would hope, or I would wish that there was more honest education about sex, sexuality for young people. I think that our education system, our religious organizations, and even parents, and I don't mean to berate or demonize those people, but fall short in educating young people about these topics. Sex is a perfectly natural, healthy thing to be interested in and eventually participate in. And by not communicating and talking about something that all human beings have an interest in, we're not helping those individuals. We're actually handicapping them. And I think, unfortunately, people oftentimes grow into adulthood being very, very frustrated sexually, not understanding the feelings and impulses that they have, feeling bad that they have them, and possibly not being in intimately satisfying, sexually satisfying, but also just relationally satisfying relationships.
Paul, I'm so grateful to you for sharing your wisdom with my listeners. And what a great episode. So much rich content, as I expected from you, since I've come to know you over the years as a colleague and a friend. Thank you so much for taking your time to share this.
You're welcome. And thanks for giving me an opportunity to talk about this important topic, Adam. I appreciate it.
You got it, man. This is Dr. Adam Dorsay, thanking you for listening to SuperPsyched. If you know anyone who might like it or who might benefit from listening, share it. And if you like the episode, please hit subscribe.